I came to Oregon in 1994, and in January of 1994. In April, found out that I was pregnant with my first child. My husband at the time was a seasonal worker, and he told me about La Clinica.
Before La Clinica, we all used the emergency rooms. Only when we were sick, then we'll go to the emergency rooms, which was out-of-pocket expense for everybody. And then we heard about La Clinica, and we spread the word.
The building in itself didn't look like a clinic. It looked just like a house, I remember parking in the gravel parking lot, and I go, this doesn't look like a real, I was suspecting a medical facility, but it looked very rural, like it's just a clinic in the middle of nowhere, by the railroad tracks.
It was the spring of 1989. Rain Man won the Academy Award for Best Film. Gas cost $1.10 a gallon. In Switzerland, a scientist developed the world's first web browser. And in a little building next to the railroad tracks in Phoenix, Oregon, La Clínica del Valle Family Healthcare Center opened to its first patients.
An outreach worker came to a middle of an orchard where I used to live and offered services, and not only transport me from my house to the clinic, back and forth for my appointments. That was such great relief because I didn't have a driver's license. I didn't speak the language. I didn't speak English very good. To have somebody come to me in the middle of an orchard and take me to an appointment and offer these services, it was just like, wow, I want to do that sometime.
Jackson County was home to 140,000 people as the 1980s drew to a close, about 4% of them Latino. Many Latinos had come to work in the Rogue Valley's orchards. A team including the late Hank Collins, then head of the county health department, saw the need for health care for the new residents. A health center known as Clinica Azteca faltered shortly after it started, but supporters rallied again and reorganized into the beginnings of the La Clinica we know today.
It was a very busy place, but it was small, and because there were so few employees, maybe a dozen, 15 at the time, we were really like family. And we could actually make decisions as a group.
In the early days, Williams and physician Deborah Gordon, La Clinica's first medical director, struggled to find staff qualified to care for a growing load of patients. Paul Rosticus soon signed on along with Patrick Wedlake, Miriam Soriano, and Jim Shames, now Jackson County's medical director. Shames recruited Birkenstock-clad friends from the Tequilma People's Clinic near Cape Junction.
Some of them had very long hair, long beards, Birkenstocks, blue jeans. We would put a white coat over them. And I can remember seeing certain young pregnant women looking up with just fear in their faces when somebody with this very long beard and long ponytail would come out, and that's what's going to be their doctor or their nurse practitioner for the day. So it was always very interesting watching the interactions between the clientele, the patients that we had, and our staff.
With its location a few feet from the railroad tracks, the building presented challenges as well.
The folks who were in charge of scheduling knew not to schedule certain procedures at certain times. Procedures like vasectomies and such didn't want to be happening as the train would go by because the entire building would shake for a good 15-20 seconds. And this would happen a couple of times a day. But we knew, and we had it marked in the schedule book, so that that sort of thing hopefully would not be happening when the train would go by.
La Clinica was growing. Williams wanted to add a dental service but couldn't figure out how to fit it into the little clinic, and doctors were running out of room to see patients. Soon, La Clinica decided to ask community boosters Dennis Barr, Gary Miller, Bill Williams, and the late Jane and Dunbar Carpenter to serve on a committee to raise money needed for construction of a new place to provide care. At more than 15,000 square feet, their dream seemed almost impossibly grand. A fundraising campaign started in 1994, and the building now known as Phoenix Health Center opened in 1996. It included space for a future dental service.
It was very large. I mean, it was just putting on a size pants that are 5 sizes too big. I'm never going to grow into this. And we did very quickly, really. It made you feel valued. And I'm sure the patients felt valued. And that was the important part.
La Clinica grew in those years in ways likely unnoticed by patients. In 1995, a newly minted nurse named Brenda Johnson joined the staff as a diabetes educator. Brenda was named interim director in 1999 and in 2000 became La Clinica's CEO, leading the organization through its biggest changes yet.
And I'll tell you, I think the board took a big risk on me. I really do. I was young and a new mom and extraordinarily passionate about the work.
La Clinica began to open school-based health centers, launched a mental health program for uninsured patients, and opened the West Medford Health Center. By 2004, dental staff was visiting schools with the Happy Smiles Dental Prevention Program, and in 2005, La Clinica added certified nurse midwives to its prenatal staff and specialized services for women. Central Point Health Center and the Women's Health Center opened in 2008, followed by the 34-chair East Medford Dental Clinic and La Clinica Mobile Health Center in 2012.
What I realized is that how efficiently they were evaluating where they were needed, places where they were needed, and locations where they were needed. And I thought that was really incredible and very professional in the aspect of very caring, because they were actually targeting and focusing on the needs of the community.
From the beginning, the organization has worked to serve patients' needs, but as the final pieces of the Affordable Care Act became law, that focus grew even stronger. La Clinica's primary health centers were recognized by the state for patient-centered care in 2012 and by the National Committee for Quality Assurance in 2013. Today, as La Clinica celebrates its 25th anniversary, the organization that started as the tiny migrant health center near the railroad tracks in Phoenix is an essential and thriving part of the community, providing more than 1 in 10 Jackson County residents with essential health services.
Without a place like La Clinica to come to, hardworking, low-income families, Anglo or Hispanic, they're not going to have an easy time of getting any kind of service because it's simply unaffordable.
La Clinica is an integral part of the puzzle that really creates a stronger economy.
And I think that the community sometimes doesn't realize what a big role La Clinica has taken on over the years, but if you really look at the numbers, it's really staggering.
I understand that, if you are discussing some major healthcare initiative, La Clinica needs to be at the table. Or maybe it was the one that started that innovative healthcare initiative.
I feel so grateful, to be part of something that's as special as this.
As it looks to the future, La Clinica celebrates community supporters, patients, and most definitely the many people who have served as employees and board members. Their contributions and dedication have made all the successes possible.